Hey everyone, my name is Alexi Grabovi and I am Dr. G's oldest son. This is my brother Patrick and this is my sister Mariana. So we want to talk to you today about the dental office reopenings. As kind of part of that conversation, we're going to cover what the governor has stated as his reopening plan and the requirements, what Parkside's doing, what things are going to change in terms of like your visit to the office, and that'll be pretty much it. But so first things first, you may have heard recently Governor Andy Beshear announced that dental offices and other medical facilities can reopen if they are able to take certain precautions. So what are these precautions? They primarily include, staff having enhanced personal protective equipment, elimination of traditional waiting areas, enhanced workplace sanitation and hand hygiene. Patients are going to have to wear a mask or a face cover, airflow considerations, and patient and staff temperature and questionnaire screenings. So at Parkside, we're obviously going to do all of these, but we're going to go far above and beyond these requirements because, not only do we want to keep our patients safe, and that's critical, we also need to keep our staff and their families safe too. So here are all the things that we're going to do, or at least a sample of them that I can fit in this video. So our staff is going to be, of course, using the highest level of PPE. That means N95 masks, plus surgical masks, plus face shields, plus surgical gowns, head caps, goggles, gloves, etc. The works. The office is going to be equipped with high-level HVAC filters. They're going to kill any bacteria that pass through them. And then we're going to be using UV light radiation, actually, to disinfect all the office surfaces twice a day, on top of actually wiping down all the surfaces with essentially, it's like a medical grade Clorox wipe after every single patient visit. So the patient schedule is actually going to also be staggered to minimize patient-to-patient contact. And what we're going to do is we're going to place an empty operatory room, which is it's like a treatment room, in between patients that are being treated. We're lucky enough to have enough space in order to do that most of the time, and so we're going to do that to try to increase the distance between treatments and people. So we're also actually pretty lucky to have an isolated closed door treatment room, which means like the walls go all the way up and the door closes, and it's very unusual typically actually for dental offices. Very few dental offices have that. We just recently actually added that in when we built the new Highlands practice. And so that's going to allow us to do some treatments that are a little more intensive that might not be safe otherwise to do in kind of like the typical layout of a dental office. So also while working on your teeth, there's going to be some changes. We're going to be using a mouth barrier to isolate the treatment area so that it covers the remaining portion of the mouth and it only exposes that whole portion of your mouth that we need to work on, and that's going to minimize exposure and particle disbursement. And also we're going to be using a high-speed suction to suck out any kind of particles that kind of get dispersed. The treatment protocols have been changed to where essentially once you get into the treatment room, it's like a locked vault. I mean, nobody leaves in or out unless absolutely necessary, because we want to keep everything contained, and then the only time you leave is when you're done, and then everything gets wiped down clean, UV lighted, the works. So in addition to that, there's some other more basic things, just like staff clothing decontamination, mask cover, face covers for patients, hand washing, package supplies, disinfection, staggering of employee lunches and breaks to minimize contact and crowding, or reduced use of water spraying equipment, massive amounts of hand sanitizer, antimicrobial rinses, temperature readings, and the like. So, as you can see, we're obviously making every effort to keep everyone safe. And so how does this actually impact your appointment? So it actually is not going to change much of what you see or experience. There's going to be a couple things, so I'm just going to lay those out for you. First of all, you're going to see that our staff is decked out in a lot of protective wear. Don't worry, we're still the same goofy bunch. We just have more layers on. Think of us like onions. So our staff is also, right, so we're going to have all these layers on, and then the lobby is also going to be effectively turned into an exclusive nightclub. Limited admission. One person allowed in the lobby at any point in time. Of course, patients will be checking out, so that'll be the only time where there's maybe two patients are crossing. But we have a big lobby, so that works out just fine. Also, though, the only way to get into this nightclub lobby is to either have a mask on or some sort of face covering. So pick your favorite scarf. We can't wait to see what you can come up with. You're going to have to sanitize your hands as you walk in the door. So, no magazines in the lobby. Remote control is only going to be at the front desk and only handled by the front desk. So we hope you like telenovelas. And you're gonna have to take that survey that's required by the governor. And also, we want to know how high you are, so you're gonna have to get your temperature taken. We bet some of you guys haven't been using Listerine like you should, so we're gonna give you an antimicrobial rinse. And then, while we would love to give you high fives, handshakes, hugs, fist bumps, and the like, we're gonna have to keep our distance when you guys visit. Don't worry, we still love you. So our hope is that all these precautions are complete overkill and redundant, because there's nothing more important than keeping you guys safe and our families safe. And so that's why we're doing all of this, and obviously taking a lot of effort to get the safest kind of environment possible prepared for you. So we want to thank you for your support. As you can see, we're a local family-run business, and that's becoming harder and harder these days. So please, share, like, recommend our posts, comment on our Facebook, promote us on social media if you can. That will really help us out, especially during these uncertain times. And so anyways, thanks everyone. Stay safe, and we'll kind of post update videos as new guidance comes out and the like, so stay tuned.